Hello and welcome. I'm your host, Neil Howard, here on Health Professional Radio. Thank you so much for joining us for another segment. In this segment, we're going to have a conversation with Dr. Todd Johnson. He's joining us here from M2GEN. Now, M2GEN is an oncology-focused health informatics solutions company. He's going to talk about the company and basically tell us what it is that they are involved in. Thanks for joining us, Dr. Johnson.
Thanks, Neil. Great to meet you, and thanks for inviting me.
Well, tell us a bit about yourself and what M2GEN does.
Sure. Yeah, happy to. Let me start with a company. M2GEN is a very fast-growing company that has built the world's largest repository of cancer discovery data. Just let me define that for you. By discovery data, I'm referring to information that can be used to discover new targets for treating or preventing cancer.
A little bit of your background.
Yeah, sure, Neil. I'm a physician scientist by training. Mm-hmm. I started my career in a cancer research laboratory at the University of Pennsylvania. This was a pretty well-known lab by the name of a guy by the name of Peter Nowell. Dr. Nowell discovered the first linkage between DNA and cancer, which he called the Philadelphia chromosome, later understood as the target behind one of the most successful cancer treatments ever, which is known now as Gleevec. I'll give you a little bit more background here. Cancer is a disease of genetics, and it starts when changes in a patient's DNA occur in their genes. There are lots of different causes of mutation. You can think of anything from the sun's UV rays to chemicals like those that can be found in cigarettes or some types of food. And there are nearly 30,000 genes in the human body. Those full 30,000 genes are called the whole exome. And so far, scientists have discovered about 500 genes, so about 2% of the whole genome of the whole of all of those genes are in some way implicated in cancer. So if I tie my work with Dr. Nowell back in the day to the data set that we've developed at M2GEN, the M2GEN data really powerfully allows scientists to explore not just the 500 known genes, but the whole exome, the other 29,000 or so that could also be involved in cancer as well. So the data that we have is really unique in its ability to look at all of those genes and how they're expressed, and then also marry that picture with the clinical picture of how each patient progresses through their care, what medications they take, what their test results show, how their health evolves over the course of their lifetime. So that's really powerful data, and that's the reason why I joined M2GEN as Chief Growth Officer last year.
Well, it's my understanding that M2GEN is involved with the Oncology Research Information Exchange Network, or Orion. Tell us about this network and how it's using this data to personalize cancer care.
Yeah, I'd be happy to, because Orion is it's a really amazing network, an amazing collaboration that provides the patients and the patient data that is behind M2GEN. Orion, as you mentioned, stands for Oncology Research Information Exchange Network, and it's an alliance of 18 of the most important cancer centers in the U.S. And it brings all of those 18 cancer centers together, aimed at sharing data to advance collaborative oncology research. But I think what's really amazing and different about Orion is the approach that Orion takes in terms of how it treats patients and patient data. Every cancer patient that participates in the Orion program, which we call Total Cancer Care, every patient gives their direct permission through an actual consent form to donate their tissues and their data for life, for research. That's very powerful, and there's almost no other company in the area, in the industry, that does this. And it's powerful and it's important because that permission from patients, the fact that patients are informed about how their data and their tissue specimens are going to be used, that then allows us to work closely with their doctors and their nurses at the cancer centers to get additional information about each patient's care. Info like what stage was their tumor? Can we take a look at their CAT scan? Can we ask the patient directly how they're feeling? Can we even follow up with the patient 5 or 10 years later and see how they're doing? So that access to additional data, additional images, long-term outcomes, that can be really important to research. So that's what makes Orion really special and really different from any of the other research networks out there.
Do you just collect all of the data that you find available, even with this permission, or are there certain types of data that is collected? I mean, is Orion collecting all of it and then kind of sifting it out, or are you specifically targeting certain data for efficiency's sake?
Yeah, we have a standard data set, very comprehensive, always including outcomes. That we capture from every patient, but we don't need to stop there. In other words, we can and do capture many different types of data through Orion. Think of it as, or the way we think of it is, the more comprehensive a picture of each patient that we can build, the more clues researchers can then look into to try and find out what might have caused a patient's cancer, or said differently, the more leads that we can then track down to try to discover and see if they could be important as a new cure. As I mentioned earlier, our patients give us lifetime access to their data. And so we can continually interact with Orion members to update the data, to understand over time how patients are doing. And for some patients now, we have over 10 years of data because we've been following that long. And then, as I mentioned, patients also donate their tissue specimens to us, and that results in a different type of data, going back to that whole exome sequencing. So on each of the patients that we bring into what we call our avatar data set, and today we've got we're closing in on 25,000 patients who we have now taken into avatar, on whom we perform whole exome sequencing. So that gives us the DNA code to every one of the 30,000 genes in the human body, and whole transcriptome sequencing as well. So we also get to understand the RNA code, which tells us which of those genes are turned on or turned off in a cancer, is another important clue. And then lastly, we collect other data types, as I mentioned earlier: images, outcomes data, tumor staging. For some tumor types, we have tumor staging data for nearly every patient in that cohort. So really anything that could be of interest and could help us work toward a new cure.
Recently, President Biden announced a cancer moonshot initiative aimed at reducing cancer death rates. Could you tell us more about this initiative and how M2GEN could possibly be involved in it?
Sure, happy to, Neil. Yeah, the Cancer Moonshot's an amazing initiative. The Biden administration recently revealed a detailed plan that aims at reducing cancer death rates by 50% in the next 25 years. And there's a big emphasis in the moonshot on funding collaborative efforts in cancer research. The president's stated goal demonstrates his belief in the power of collaboration to make research move faster, build more ecosystems of the willing, if you will. And at M2GEN, we really applaud the Cancer Moonshot Initiative. It makes a lot of sense to us. We have proven and we can demonstrate that collaboration across many of these academic medical centers results in great discoveries. And so it's closely aligned with the approach that we're taking along with industry and Orion. So I'd say if you're a researcher out there or anybody involved in the cancer space, and if you want to become part of the solution, give us a call. We're always adding more interested parties to Orion and always interested in helping to advance new research.
Well, if you would, give us a website where our listeners can learn much more about M2GEN.
Yeah, sure. You can find us at www.m2, the number 2, and then GEN.com.
Todd, I appreciate you lending us some of your time this morning. Hopefully we'll have an opportunity to speak again.
Thanks, Neil.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Todd Johnson of M2GEN. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.